First of all, I want to express my full sympathy for those who are suffering of the coronavirus, and I want to thank the medical staff who are treating them and doing an outstanding job, not only in Europe, but all over the world. As you know, the coronavirus has brought governments and health systems throughout Europe to work at all different levels to contain this virus. And so does the Commission, with the support of our agency, the ECDC, and in very close cooperation with the WHO. You've witnessed that from the very beginning of the outbreak of the coronavirus, the European Union has acted. We have, for example, activated our alert system immediately. We have an ongoing risk assessment that is being carried out in close coordination with all the member states. I think very important is our European Health Security Committee that is coordinating all these different national measures so that we have a very comprehensive approach to contain the virus. We have informed you on a regular basis over the last weeks about the support that the Commission provides to the national authorities in very close cooperation with the agencies. ECDC has announced today that the risk level has risen from moderate to high for people in the European Union. In other words, the virus continues to spread. We all know that the many, many different actions that are needed to address coronavirus are very multifaceted. They are very manifold, and since 8 weeks, we're working intensively on these different work strands. The Commission has been addressed all these work strands. We have a situation that is very complex, and it requires on one side very swift action, and on the other side a strong coordination on all the levels and all the different sectors, not only on the European level, but of course on the national level, and then a very comprehensive and coherent approach towards the topic from all 27 member states and the European Union. This is why today we are launching the Corona Response Team. This Corona Response Team brings together all the different strands of action that have been in place since many, many weeks. You have witnessed their outstanding work, but also brings in place in the Corona Response Team the new ones, the new work streams, the emerging work streams. The Corona Response Team, we have given you a graph. Perhaps you move a bit aside. Thank you so much. You have it here on the screen, and you must have the slide 2. It has basically 3 main pillars. The first pillar is the medical field. As you can see, it includes topics from prevention and procurement. There are relief measures, information, and foresight. It's always in close cooperation with the ECDC and our European Medicines Agency. The second big and important column is the pillar that covers mobility, from transport to travel advice, and also to the Schengen-related questions. The third pillar covers the economy. It is looking in depth at various business sectors, such as tourism or transport, trade, but of course it's looking also at the value chains and at the broader macroeconomic picture we have. To bundle this, we also have in parallel launched today a website on the Coronavirus Response Team where all the informations we've gathered over all the weeks and that come on a daily basis are collected and bundled so that there is a direct access to the very complex, wide-reaching work the Corona Response Team is doing. You see on the slide 2 that there are other topics that are presented on the website and worked on in the Corona Response Team, as for example news, press releases, calendar, social media, statistics which are important on a daily basis from all over the different questions that occur in this scenario, the general informations like access to studies or links to others, the roles and responsibility again if you have different questions that have to be addressed. Allow me now to introduce the 5 commissioners who will be working together on all these different topics. It is Janusz Lenarczyk, who is in charge of crisis management. It is Stella Kyriakides, who is in charge of all the health issues. It is Ylva Johansson, who is in charge of border-related issues. It is Adina Valean, who is in charge of mobility, and Paolo Gentiloni, who is dealing with the macroeconomic aspects. And I would like to invite the different commissioners now to present their aspects for the day, because this is a situation where on a daily basis we have actual news and topics we want to work on.